Phlebotomy Exam Prep 2026. Question 1. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 2. Which of the following is an example of a vector-borne transmission? Option A, contracting a cold from an airborne sneeze. Option B, acquiring a skin infection from a contaminated countertop. Option C, getting bit by a mosquito infected with West Nile virus. Option D, drinking water containing bacterial toxins. The correct answer is option C, getting bit by a mosquito infected with West Nile virus. Vector-borne transmission involves a living carrier that moves an infectious agent from one host to another. Mosquito transmission of West Nile virus is a classic example. Airborne droplets, contaminated surfaces, and contaminated water represent other transmission routes. Question 3. How many times should a light blue top tube be inverted immediately after collection? Option A, 1 to 2 times. Option B, 3 to 4 times. Option C, 5 to 8 times. Option D, 10 to 12 times. The correct answer is option B, 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 4. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option of light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 5. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option of lactic acid and ammonia. Option B, cold agglutinins and cryoglobulins. Option C, bilirubin and vitamin B6. Option D, prothrombin time, patient. The correct answer is option A, lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 6. What is the primary function of the anticoagulant EDTA? Option A, it enhances the action of thrombin. Option B, it binds calcium ions, preventing the clotting cascade from activating. Option C, it destroys white blood cells to preserve red cells. Option D, it stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B, it binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 7. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option of leukocytosis. Option B, leukoponia. Option C, thrombocytopenia. Option D, polycythemia. The correct answer is option B, leukoponia. Leukopenia means an abnormally low white blood cell count. It may indicate marrow suppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass. Question 8. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A. The needle will slip and miss the vein entirely. Option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C. The patient's blood pressure will drop rapidly. Option D. The vacuum inside the collection tube will increase significantly. The correct answer is option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 9. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A. Lavender, green, red. Option B. Red, green, lavender. Option C. Green, lavender, red. Option D. Light blue, lavender, green. The correct answer is option A. Lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 10. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A. Wash the site with soap and water and immediately report the incident to a supervisor. Option B. Squeeze the wound to expel blood and apply a tight bandage. Option C. Wait until the end of the shift to fill out an incident report. Option D. Ask the patient if they have any blood-borne infectious diseases. The correct answer is option A. Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 11. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 12. Which analytical error is categorized as a pre-examination, pre-analytical error? Option A. Miscalibrating a chemistry analyzer machine. Option B. Misidentifying a patient before collecting their sample. Option C. Misinterpreting a reading on a microscopic smear sheet. Option D. Delays in transmitting finalized electronic reports to the doctor. The correct answer is option B. Misidentifying a patient before collecting their sample. Misidentifying a patient before collection is a pre-examination error because it occurs before the specimen is analyzed. Pre-analytical errors often have the greatest impact on patient safety because the wrong sample can produce a believable but unsafe result. Analyzer calibration and report transmission belong to later phases. Question 13. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A. 5 to 10 degrees. Option B. 10 to 15 degrees. Option C. 30 to 45 degrees. Option D. 60 to 90 degrees. The correct answer is option B. 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 14. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C. To cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 15. What color tube top indicates that the tube contains the additive sodium heparin? Option A light blue. Option B dark green. Option C lavender. Option D light green. The correct answer is option B, dark green. Dark green tubes indicate sodium heparin in many tube systems. Sodium heparin prevents clotting by interfering with thrombin activity and is used for selected chemistry or special testing. Light green usually contains lithium heparin with gel, while lavender and light blue contain different anticoagulants. Question 16. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 17. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 18. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A, extensive hemolysis from using a small gauge needle. Option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Option C, icterus caused by elevated levels of circulating bilirubin molecules. Option D, failure to invert an additive tube immediately after collection. The correct answer is option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 19. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A, to stop the arterial blood flow to the limb. Option B, to engorge the veins and make them more palpable. Option C, to anchor the vein and prevent it from rolling. Option D, to ensure the sterility of the puncture site. The correct answer is option B, to engorge the veins and make them more palpable. A tourniquet temporarily slows venous return so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 20. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 21. Which of the following can lead to a rejected specimen due to short draw? Option A, inverting a lavender tube 8 times. Option B, underfilling a light blue coagulation tube. Option C, using a 21 gauge needle on a large vein. Option D, drawing a serum separator tube before a green tube. The correct answer is option B, underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 22. Which of the following elements is a primary link in the chain of infection? Option A, the source or reservoir of the pathogen. Option B, the cost of personal protective equipment. Option C, the layout of the outpatient laboratory facility. Option D, the brand of antiseptic wipes used to clean benches. The correct answer is option A, the source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 23. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 24. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 25. What type of fluid is obtained during a lumbar puncture procedure? Option A, pleural fluid. Option B, synovial fluid. Option C, cerebrospinal fluid, CSF. Option D, peritoneal fluid. The correct answer is option C, cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 26. What type of hazard is represented by the yellow quadrant of the NFPA 704 diamond? Option A, health hazard. Option B, flammability hazard. Option C, instability or reactivity hazard. Option D, specific or special hazard. The correct answer is option C, instability or reactivity hazard. The yellow quadrant of the NFPA 704 diamond represents instability or reactivity. It warns how readily a material may react, decompose, or explode under certain conditions. Health, flammability, and special hazards are shown in the other quadrants. Question 27. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 28. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A, 70% isopropyl alcohol. Option B, tincture of iodine. Option C, chlorhexidine gluconate or soap and water. Option D, hydrogen peroxide. The correct answer is option C, chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 29. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option A, recapping the needle before throwing it away. Option B, placing the needle in a biohazard bag. Option C, activating the safety device and placing it in a sharps container. Option D, dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C, activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 30. What is the function of the thixotropic gel inside an SST or PSD tube? Option A, to accelerate the coagulation cascade. Option B, to form a physical barrier between cells and serum/plasma during centrifugation. Option C, to preserve glucose levels for up to 24 hours. Option D, to chelate calcium and prevent fibrin formation. The correct answer is option B, to form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 31. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 mm. Option B, 1.8 to 2.4 mm. Option C, 3.0 to 4.0 mm. Option D, 4.5 to 5.0 mm. The correct answer is option B, 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 32. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 33. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood. Question 34. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A, hematoma. Option B, hemolysis. Option C, petechiae. Option D, ichthyosis. The correct answer is option C, petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 35. For which of the following tests must the specimen be protected from light immediately after collection? Option A, ammonia. Option B, bilirubin. Option C, lactic acid. Option D, prothrombin. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 36. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A, cyanosis. Option B, jaundice, icterus. Option C, erythema. Option D, pallor. The correct answer is option B, jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 37. What type of consent occurs when a patient is fully informed of the risks, benefits, and alternatives of a procedure and signs a document? Option A, informed consent. Option B, implied consent. Option C, verbal consent. Option D, statutory consent. The correct answer is option A, informed consent. Informed consent occurs when a patient understands the procedure, risks, benefits, and alternatives and documents agreement. It is more formal than routine implied cooperation. Verbal or implied consent may be enough for many routine draws, but signed informed consent is used when required by policy. Question 38. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A, rapid hematoma formation and bright red pulsing blood. Option B, falsely decreased systemic blood pressure. Option C, accelerated hemolysis within the vacuum collection tube. Option D, immediate collapse of the surrounding capillary beds. The correct answer is option A, rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 39. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 40. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A, to eliminate surface bacterial contamination from the skin. Option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. Option C, to prevent the blood from clotting too quickly in the microcollection tube. Option D, to ensure that the blood flow is adequate for collection. The correct answer is option B, to remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 41. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A. Adjust the depth of the needle to stop the swelling. Option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. Option C. Advance the needle further to bypass the hematoma. Option D. Request the patient to pump their fist to redistribute the blood. The correct answer is option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 42. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A. Press down hard on the needle to flatten out the swelling. Option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C. Switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D. Continue the draw until all ordered tubes are filled completely. The correct answer is option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 43. Which additive acts as a glycolytic inhibitor in a gray top tube? Option A. Sodium fluoride. Option B. Lithium heparin. Option C. DDTA. Option D. Thrombin. The correct answer is option A. Sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in gray tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 44. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 45. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A. Draw the blood from a capillary puncture if the tests allow. Option B. Turn off the for yourself and draw above the line immediately. Option C. Draw from the foot or ankle without a physician's order. Option D. Postpone the draw indefinitely until the patient is discharged. The correct answer is option A. Draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 46. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A. Shaking the tube vigorously up and down 10 times. Option B. Inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type. to ensure adequate mixing without causing hemolysis. Option C, letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D, rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 47. Which of the following tubes contains the anticoagulant lithium heparin? Option A, light green top, PSD. Option B, dark blue top. Option C, yellow top. Option D, gray top. The correct answer is option A, light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 48. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 49. What should a phlebotomist do if they encounter an unconscious patient in an emergency room with no identification button? Option A, refuse to draw the blood until the patient wakes up and identifies themselves. Option B, to assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. Option C, use the name written on the patient's personal clothing or belongings. Option D, label the tubes with John Doe and leave the medical record number blank. The correct answer is option B, assign a temporary unique numeric identifier to the patient according to facility protocol and label tubes accordingly. An unidentified emergency patient may receive a temporary unique identifier under facility protocol. Specimens are labeled with that identifier so testing can proceed while maintaining traceability. Clothing, belongings, or generic names are unsafe sources of identity. Question 50. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A, patient's first name, last name, and unique medical record number. Option B, patient's room number and name of their primary insurance carrier. Option C, name of the ordering physician and the date the patient was admitted. Option D, patient's diagnosis code and home phone number. The correct answer is option A, patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 51. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A, place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B, drop the needle into a biohazard waste bag with blood-stained gauze. Option C, set the needle down on the patient's bedside table until the tubes are fully labeled. Option D, detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A, place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 52. What is the clinical purpose of performing a bleeding time test? Option A. To evaluate the integrity of the intrinsic coagulation pathway. Option B. To assess platelet function and the capillary bed's ability to form a primary plug. Option C. To measure the absolute concentration of fibrinogen molecules in plasma. Option D. To screen the body for active systemic bacterial infections. The correct answer is option B. To assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 53. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A. Chilled on a slurry of ice and water. Option B. Maintained at body temperature, 37 degrees Celsius. Option C. Protected entirely from light exposure. Option D. Frozen immediately in dry ice. The correct answer is option B. Maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid. Question 54. For which of the following tests must a phlebotomist use a gray top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses gray tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 55. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 56. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 57. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A. Cryoglobulins. Option B. Ammonia. Option C. Lactic acid. Option D. Free fatty acids. The correct answer is option A. Cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 58. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option D, lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 59. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A, collecting blood from a patient with a suspected MRSA skin infection. Option B, drawing samples from a patient diagnosed with measles or active varicella. Option C, performing venipuncture on a patient with seasonal rhinovirus. Option D, collecting a lipid panel from a patient with hepatitis C. The correct answer is option B, drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 60. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 61. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A, the veins are too large and prone to exploding. Option B, the lack of muscle movement leads to poor circulation and potential thrombosis. Option C, the patient cannot feel if a nerve is being struck by the needle. Option D, paralyzed limbs do not contain white blood cells. The correct answer is option B, the lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 62. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A, syncope. Option B, lymphedema and altered test results. Option C, petechiae. Option D, sclerosed veins. The correct answer is option B, lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 63. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 64. Which of the following statements is true regarding standard precautions in healthcare settings? Option A, they apply only to patients with known, documented infectious diseases. Option B, they mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C, They require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D. They permit the recapping of used needles as long as you use 2 hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 65. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option F 1.0 mm, option B 2.0 mm, option C 3.0 mm, option D 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 66. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A. Convince the patient by explaining the doctor's orders. Option B. Proceed with the draw while the nurse holds the patient's arm. Option C. Document the refusal and immediately notify the nursing staff or provider. Option D. Leave the room and mark the collection as completed. The correct answer is option C. Document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 67. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A. Human immunodeficiency virus, HIV. Option B. Hepatitis B virus, HBV. Option C. Tuberculosis, TB. Option D. Malaria. The correct answer is option B. Hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 68. Which of the following parameters can cause a false decrease in glycolysis tracking within a serum specimen? Option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Option B. Chilling the specimen on ice immediately after collection. Option C. Protecting the specimen from exposure to room lights. Option D. Mixing the tube gently 5 times right after the draw. The correct answer is option A. Leaving the serum in contact with the red blood cells for longer than 2 hours. Glucose decreases when unseparated blood remains at room temperature because cells continue glycolysis. Serum left in contact with red cells for more than 2 hours can therefore show falsely low glucose. Prompt separation or use of a glycolysis inhibitor helps preserve the result. Question 69. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A. Full name and room number. Option B. Full name and date of birth. Option C. Attending physician and bed number. Option D. Date of birth and diagnosis. The correct answer is option B. Full name and date of birth. 2 reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 70. Which of the following tubes is typically selected for a zinc, copper, or trace element determination? Option A. Royal blue top tube. Option B. Lavender top tube. Option C. Light blue top tube. Option D. Grey top tube. The correct answer is option A, royal blue top tube. Royal blue top tubes are designed for trace element testing such as zinc and copper. They minimize contamination from tube components that could falsely elevate trace metal results. Routine additive tubes are not manufactured to the same low contamination standards. Question 71. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing, POCT, instruments? Option A, calibrating the machine once every year. Option B, running control solutions at scheduled intervals according to facility protocol. Option C, cleaning the display screen with water after every patient test. Option D, trusting the automated self-check system without external verification. The correct answer is option B, running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 72. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A, droplet transmission. Option B, contact transmission. Option C, airborne transmission. Option D, vector-borne transmission. The correct answer is option C, airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 73. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 74. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B, tighten the tourniquet further to stop the spots from spreading. Option C, ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D, rub the skin surface firmly to see if the spots disappear. The correct answer is option A, remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 75. What does a trough level measure in therapeutic drug monitoring, TDM? Option A, the highest concentration of the drug in the patient's system. Option B, the lowest concentration of the drug, measured right before the next dose. Option C, the average concentration of the drug over a 24-hour window. Option D, the amount of drug excreted through the kidneys. The correct answer is option B, the lowest concentration of the drug, measured right before the next dose. A trough level measures the lowest drug concentration, usually just before the next scheduled dose. Timing is critical because the result guides dosing safety and therapeutic effectiveness. Peak levels measure the highest concentration after dosing and answer a different clinical question. Question 76. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A, N95 respirator and gloves. Option B, gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 77. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 78. What is the primary function of the circulatory system's capillaries? Option A, transporting blood under high pressure away from the ventricles. Option B, permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Option C, directing large units of blood directly into the vena cava pathways. Option D, preventing the backflow of lymph fluid into the deep tissues. The correct answer is option B, permitting the exchange of nutrients, gases, and waste products between blood and tissue cells. Capillaries are the exchange vessels of the circulatory system. Their thin walls permit transfer of oxygen, carbon dioxide, nutrients, and waste products between blood and tissues. Arteries and veins mainly transport blood to and from capillary beds. Question 79. What is the primary function of leukocytes? Option A, carrying oxygen to body tissues. Option B, preventing blood loss through clotting. Option C, defending the body against foreign pathogens. Option D, maintaining osmotic pressure in the plasma. The correct answer is option C, defending the body against foreign pathogens. Leukocytes are white blood cells that defend against infection and foreign material. They include several cell types involved in immune response, inflammation, and pathogen destruction. Red cells transport oxygen, platelets support clotting, and plasma proteins help maintain fluid balance. Question 80. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A, wearing a laboratory coat. Option B, utilizing self-sheathing safety needles. Option C, hand washing after every procedure. Option D, disposing of waste in a biohazard trash bag. The correct answer is option B, utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 81. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 82. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A, it is too small to yield an adequate sample. Option B, it is located near the brachial artery and median nerve. Option C, it has a high tendency to collapse under low pressure. Option D, it contains valves that prevent blood flow into the tube. The correct answer is option B, it is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 83. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 84. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A, enlist colleagues to restrain the patient by force without nursing guidance. Option B, postpone the draw and consult with the nurse in charge of the patient's care. Option C, attempt to draw blood while the patient is asleep. Option D, cancel the test order permanently on your own authority. The correct answer is option B, postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 85. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A, 30 seconds. Option B, 1 minute. Option C, 2 minutes. Option D, 3 minutes. The correct answer is option B, 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 86. Which of the following practices is an example of an engineering control to prevent blood-borne pathogen exposure? Option A, wearing a face shield when opening specimen tubes. Option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Option C, washing hands with antimicrobial soap for 20 seconds. Option D, following a strict order of draw sequence. The correct answer is option B, utilizing a sharps container with a wide, drop-in opening and safety needle shields. Sharps containers with safe openings and safety needle shields are engineering controls because they isolate or remove the hazard by design. These devices reduce needle stick risk during and after collection. Gloves and training are important but do not physically engineer the hazard away. Question 87. Specimen tubes must be labeled at what point during the collection process? Option A, prior to entering the patient's room. Option B, immediately after drawing the blood, before leaving the patient's side. Option C, at the central processing lab desk. Option D, after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 88. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 89. Which of the following is the most critical step in performing any phlebotomy procedure? Option A, choosing the correct size needle. Option B, verifying patient identification. Option C, selecting the appropriate vein. Option D, applying the tourniquet tightly. The correct answer is option B, verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 90. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A, releasing the tourniquet within 1 minute of needle insertion. Option B, keeping the patient's arm down during the venipuncture procedure. Option C, allowing the patient to pump their fist repeatedly before and during the draw. Option D, transporting the specimen to the laboratory within 30 minutes. The correct answer is option C, allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 91. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A, the potassium level will be falsely elevated. Option B, the potassium level will be falsely decreased. Option C, the sodium level will rise to compensate. Option D, the hematocrit level will drop below readable thresholds. The correct answer is option A, the potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 92. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A, call for an emergency code. Option B, complete the current tube collection. Option C, remove the tourniquet and needle immediately. Option D, place a cold compress on the patient's forehead. The correct answer is option C, remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 93. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A, proceed immediately to get the draw over with quickly. Option B, instruct the patient to take slow, deep breaths and offer reassurance. Option C, reschedule the test for a different week. Option D, administer a sedative if available in the room. The correct answer is option B, instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 94. Why is the first drop of blood wiped away during a capillary puncture? Option A, it contains skin surface bacteria. Option B, it contains tissue fluid contamination. Option C, it hemolyzes too rapidly to be accurate. Option D, it clots too quickly to be collected. The correct answer is option B, it contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 95. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 96. Which of the following tests requires a fasting specimen to ensure diagnostic accuracy? Option A, complete blood count, CBC. Option B, lipid panel and fasting blood sugar. Option C, blood culture series. Option D, prothrombin time, patient. The correct answer is option B, lipid panel and fasting blood sugar. Lipid panels and fasting blood sugar tests are strongly affected by recent food intake. Fasting helps standardize triglyceride and glucose measurements for diagnostic interpretation. CBC, blood cultures, and patient usually do not require fasting for accuracy. Question 97. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 98. What type of isolation protocol requires healthcare workers to wear a gown, gloves, and use dedicated equipment to prevent spreading resistant GI infections like C. difficile? Option A, airborne isolation. Option B, droplet isolation. Option C, contact isolation. Option D, protective reverse isolation. The correct answer is option C, contact isolation. Contact isolation is used for organisms spread by touch or contaminated equipment, including resistant gastrointestinal pathogens such as C. difficile. Gown, gloves, and dedicated equipment reduce environmental spread. Airborne and droplet precautions target respiratory transmission routes. Question 99. Which of the following statements matches the correct definition of assault? Option A, unjustified or unconsented physical contact with another person. Option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C, revealing confidential medical findings to unauthorized personnel. Option D, mislabeling a laboratory specimen tube by accident. The correct answer is option B, the intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 100. What clinical condition is characterized by fluid accumulation in the intercellular tissue spaces, making the arm swollen? Option A, lymphedema or edema. Option B, petechiae. Option C, sclerosis. Option D, hematoma. The correct answer is option A, lymphedema or edema. Lymphedema or edema describes swelling from fluid accumulation in intercellular tissue spaces. It may occur after lymph node removal, obstruction, injury, or other circulation problems. Drawing from a swollen limb can be difficult and may produce unreliable specimens.